So we spent a lot of time talking about this. I think maybe it'd be great to kind of get real practical and talk about a specific project or two. So I'm wondering if you have an example or two that you might share with us.
Absolutely. So at the Penn State Pro Wellness Center, we actually spend a lot of our time engaged with community in different types of projects. And one in particular that I'd like to highlight has been a partnership with the Boy Scouts of America. This began about 2 years ago now. And it started out as a request from the National Boy Scouts Office for assistance with addressing the obesity epidemic amongst Boy Scouts as well as across our country. And through early partnership with that organization, we tried to understand what their goals were for this project and what a partnership could look like. And as we started working through the organization and partnering with local leadership, when we met with them with some early ideas we had for family intervention, and I'll never forget the Scout executive looking me in the eye and say, well, that sounds great, but what we could really use help with is help making our camps healthier. And I said, oh, well, when do your camps occur? And he said, well, they start in about 4 weeks. Is there anything you can do to help us with that? So, of course, we put our thinking caps back on, and this I thought was a great example of how you need to meet the community partner where they are. And we came up with some really clever, innovative ways of taking what's known in other practices and translating that to the Boy Scout camp to make them healthier, both in terms of the food that they were serving, the foods that they were selling at their trading posts, and in increasing physical activity amongst the Scouts during their weeks at the camp. And this partnership expanded from our local Pennsylvania council to this past summer, where we have now partnered with Atlanta, Georgia and Phoenix, Arizona camps to reach over 15,000 Scouts with plans to go beyond for next summer as well. And one of my highlights of this Boy Scouts work is the fact that our initial Scout executive, his name's Matt Adams, who we partnered with, has really been a true partner in this work and has co-presented with us at multiple meetings. We brought him up into the panel organization that described this intervention at National Boy Scout conferences, as well as highlighting him in some of our CTSI seminar series as well. So having a true community partner who can speak to your work resonates really well for how community engaged research can change what you're planning to do.
Great, that's a really interesting example. So let me probe a little bit more on the research aspect of this. I assume, I'll sort of assume and correct me that, sort of the end goal here is to improve health or at least maybe short-term health practices sort of over the course of a camp. Are there certain outcomes then that are defined in terms of what you're trying to achieve and measured? And then is that compared to sort of how it used to be? Again, speaking a little research speak here, but maybe tell us a little bit about how this partnership actually involves research and what the research aspect of this is.
Absolutely. So there's definitely outcomes that we looked at the camp. Specific outcomes that we thought were important to identify were the concern when you increase healthful menu items is that kids will waste more food. So we actually measured plate waste. I had our team out there measuring the trash. It's a really glamorous job that they'll all attest to. But measuring plate waste both before and after healthful menu changes. We also mentioned our measured caloric intake. So specifically what was being served, looking at the nutritional content of that food and comparing it to the menu that was used before intervention. From a sales standpoint in the trading post, we measured the number of healthful items that were sold as well as sales within the trading post. One of the concerns with working with a non-for-profit organization such as Boy Scouts is they really depend on the revenue that's generated through their camp to keep the doors open. So being very sensitive to their community needs through our research helped determine what outcomes would be important. And they do very well with their trading posts, their camp store sales. So we really had to be sensitive to the fact that we could make changes, but they couldn't impact their bottom line because there's not a lot to work with. So we increased the number of healthful items within the trading post from a measly 2 items to 36 items. And by doing that, we actually were able to prove that we increased trading post sales per scout over the course of the summer by introducing slowly more items. One of the things the partnership demonstrated to us is that we really had to be cautious about going in and making all of the changes at once. So these were rolled out in a stepwise fashion so that we had time to engage the different camp staff who would be involved in the implementation of the changes and get their buy-in. And of course, having our council executives buy-in was really critical to the success of the project. He started out with an expectation at his weekly meeting with the camp leaders and said, part of our Boy Scout oath is to help our boys be physically strong. And part of being physically strong is eating healthy and getting enough physical activity. So we've got pedometers here for all of you. And we measured step count, and we tracked step count by scout over the course of the week. And we're able to see how putting in an intervention to create a little competition amongst the troops helped improve their physical activity. Even though we were told the boys were incredibly physically active at camp, we saw that their steps increased by nearly 1,000 steps each day over the course of the week. And of course, nothing like competition helps boys get a little bit more physically active. And the camp leaders shared with us stories of them running around their tents before bed, trying to get those extra steps in.
One more question on that. This is very interesting. In similar programs in other populations, the sort of concern is always sort of taking these healthy behaviors, if you will, thinking about exercise, thinking about diet, and sustaining those, sort of beyond just the intervention period. I guess in this case, it would be going back home after camp and continuing to do the same thing in terms of eating, diet, exercise. Who knows? Maybe even educating some of your family members, chastising parents for sort of buying certain food items and things like that. Are you doing any follow-up like that as part of the study?
Yeah, that's a great question. We have lots of ideas and plans for future work with the Boy Scouts. We agree this is a very short period of time, but we'd also like to think that this could be an aha moment. And I'll never forget the story that one of our camp leaders shared with us that he heard from a parent. A lot of times the Scouts will bring their fathers to the camp with them. And the boy was eating a camp lunch, which we had modified the menu for by increasing the vegetables, decreasing the carbohydrates, decreasing the sugar-sweetened beverages. And he finished his meal and he turned to his dad and he said, "Dad, why don't we eat like this at home?" And for me, it just completely warmed my heart knowing that we had served in perhaps one of what could be argued as one of the least healthy settings, a camp setting, types of food and a meal that this boy really wanted to see be used in his daily life. So our hope is that this can help spark interest. It can help set a culture that the Scouts is a place for health in addition to all of the other great activities that they engage in. And moving forward, we can translate some of these thoughts into the other Scout activities and beyond. So certainly by bringing the families to the table through the camping, through the Boy Scouts program, we can help identify support for healthy behaviors and physical activity and healthful nutrition throughout the course of the year. And it's really, really where we need to start from a policy and culture standpoint to help impact the obesity epidemic.